Hi, welcome to Kern News in the 661. I'm JaNell Gore and I'm here with Karly Beavers, the project specialist with Kern County Public Health Department. Hi Karly, thank you for being here today.
Thank you so much. I'm delighted to be here.
Can you just tell me a little bit about the work that you do?
So I am a project specialist with Kern County Public Health. I help to assist in overseeing the STD and HIV programs in the County Public Health Department. So all that we do regarding STDs and HIV services.
Okay. In the past few years, Kern County has been one of the highest in California. Can you tell me what our rates are now?
So our latest data from 2017 shows that over 10,000 STDs were reported in Kern County. This means that we have one STD reported per hour.
So what do you think is contributing into the rise of STDs?
There are several social factors that contribute to STD rates. We have a lack of comprehensive education with sexual health, including STDs. We have geographic barriers in being able to access clinics and doctors in our ability to locate those services, and if we have access to transportation. Kern County has higher rates of poverty and people experiencing homelessness. And then once you actually get to your appointment, there's the whole navigating the healthcare system, which can be confusing. So if it was just one factor that was contributing, I feel like my job would probably be easier and we would be able to tackle our STD rates a little bit better. But unfortunately, we are human beings, and so we are complex, and there are a variety of factors.
How do you think we can go about better educating the community so that it's not as hard to navigate the healthcare system?
In helping out the community, I would say it helps to first start by having a conversation. We need to have a conversation. If you are a parent or a trusted adult to a young person, it is so important to have open and honest and facts-based conversations about sexual health. It can be tricky and daunting to have those conversations. People might think that it's going to be awkward, or they're afraid that they might say the wrong thing, but research shows that young people want facts-based information from adults that they trust on topics like sexual health, STDs, and relationships. And the more that we talk and normalize conversations about sexual health, the easier it is in reducing the stigma and the shame that's associated with sexual health, which makes things so complicated to talk about. So we need to start the conversation.
What would you say to maybe an adult who also didn't have the right information given? What's the best way to go get that?
Absolutely. So if you need help in starting those conversations, and we all do because they can be complicated, I would go to reliable, evidence-based sources of information. You can start at our website at kernpublichealth.com. You can also check out the Center for Disease Control's website, which has tons of tips on how to start those conversations.
So, Karly, where does Kern County rank in the state with other counties?
We are not great. So depending on the STD, we are ranked either second, third, or fourth worst in the state, which means that we are second, third, or fourth highest rates in the state of California. In particular, we're seeing a huge increase in congenital syphilis. We are 313% higher than the state average. So we're not doing great.
What is the Public Health Department doing to provide resources for?
So Kern County Public Health does offer STD testing and treatment, in addition to rapid HIV testing, where you can know your results in 20 minutes. We also offer services like the HPV vaccine, other family planning methods, free condoms and lubricants. And in addition, we've expanded our services through our mobile health clinic, so we're trying to reach the outer-lying areas. We also offer PrEP, which is an HIV prevention tool that you can use to stay HIV negative. We offer partner notification services, so we can help you have conversations with those partners to get them tested. And we also have our website, which not only has data and resources, but also an email address, our Ask STD Clinic email, where you can email questions anonymously and still get the answers that you need.
What about the schools? Are you guys doing anything with the schools, or how do you think the schools can help to?
So Kern County Public Health does try and collaborate with the community as much as possible, and the schools are one of those things. We have our STD Action Partnership Group along with our HIV Community Partnership Groups, and these are groups of peoples that groups of people that are agencies in the community that are trying to combat STD rates just like we are. So we have quarterly meetings with folks from the department. We have the Kern High School District involved in our groups, and we meet and come together and strategize on how we can reduce our rates of STD, because that is our ultimate goal. So we do have meetings like that.
So what can residents do now besides informing? What else is there to do to combat these rates?
I would say know your status and get tested. Getting tested for STDs requires a blood sample and a urine sample. It's easy, it's quick. Depending on where you go, you can schedule an appointment, or some people offer walk-ins. And the only way to know if you have an STD is to get tested. If you do have an STD, all STDs are treatable, and they're treatable typically with very common antibiotics. So know your status and get tested. Continue to talk to people, not only your doctors, and asking to make sure that you're tested for STDs, but talking to your partners, talking to trusted peers, talking to adults, and continuing to educate and empower yourself for your sexual health. And again, if you don't know where to start on our website on Kern Public Health, visit the Centers for Disease Control. These are good evidence-based resources.
Thank you so much, Karly, for that information. So thank you for tuning in to Kern News and the 661. I'm JaNell Gore, and I hope to see you next time.